Hi, my name is Summer, and I work at Rush Memorial Hospital. We just wanted to talk to you today about your colonoscopy and your EGD procedure. But I did want to take a minute to just tell you thank you for choosing Rush Memorial Hospital. We're committed to your care, and we want to make this the best experience possible. So let's talk about your colonoscopy or your EGD. So what to expect? Let's talk about preparation for surgery. Now you'll either see the physician in the office and they'll schedule you there, or you may get scheduled from your primary care. Either way it goes, we'll get you on the surgery schedule. The colonoscopy does require some extra prep. Now this can be different for different physicians, so they will usually give you a piece of paper with those instructions. Now when we follow up with you, we'll make sure that you've got all that information because you do have to start that usually at least a day before surgery. And this is very important that you do this prep and you do it appropriately so that we're able to visualize when we actually do the procedure. Once again, these prep instructions will be given to you in the office, but we do have those if we're following up with your anesthesia care that we can give those to you. So what to expect also is once you're scheduled, the surgery department will actually call you, usually like 5 days to a week before at least, and give you a tentative time. I know your time is important and it's important to us too, and we want to make sure that you've got plenty of time to get this scheduled and worked out because you also need somebody to come with you to drive you. In between this time, you will also have anesthesia. They'll call you. They will ask you questions about your medical history, make sure that you're okay for surgery. It's really important to us that you're healthy enough that we do surgery and that we take good care of you. And then the day before surgery, they will also call you to confirm all this information. So we will call and talk about the time, the surgery time. Sometimes it can change from when they had originally called you to the day before, but usually it's the same. And then we also want to talk to you about any your medications as well. Make sure all the medications that anesthesia may have told you to stop or continue are confirmed with you, that you know specifically what you're supposed to do that day before surgery, and also to make sure that you have done your prep. Now sometimes they will call you 2 days before to go over that prep with you, but anyway it goes, you'll get a final call at least a day or two before. And it is also important that if you take any kind of herbal medications, any kind of over-the-counter medications, that you make sure that we know that. Sometimes those can actually interfere with any medicines that we may give you, or they can cause bleeding. So make sure that you let us know about anything else that you might take. So the day of surgery. So you've done all this prep, you're ready to come get your colonoscopy or your EGD. You actually are going to come to the main entrance of Rush Memorial Hospital. Now this is the one that's off of Main Street where the emergency department entrance is. When you come in, registration is on the left. So you will stop at registration, you will get registered, and they will actually bring you up to the preoperative area. Now, reminder, you've got to have somebody that can drive you. We're going to be giving you strong medication. We want you to be safe. Your safety is our priority. So you have to have somebody that can drive you home. So you will register. They're going to bring you up to the pre-op area. Here, they're going to put you in a room. They'll take your temperature. They'll make you get your clothes off and put you in a gown. And we're going to start your IV. Anesthesia will come in and talk to you again. And we'll get you all ready for surgery. And then sometimes the physician will also come and talk to you, and we'll make sure that all your questions are answered before you go back. So during surgery, so I know it can be really intimidating to go back into the surgery area. There's a lot of equipment. You know, it's usually cold back there. We'll make sure that you have a warm blanket. We're going to take excellent care of you. We're going to get you back into our surgery procedure room. Anesthesia will be back there. We'll put you on monitors. We want to monitor you very close and make sure that we do that throughout the whole procedure. Anesthesia will give you the medicine to help you kind of go to sleep. I know it can be scary to think about getting these procedures and not being asleep enough or remembering or having discomfort. But our anesthesiologists do a great job of really making sure that you're very comfortable throughout the whole procedure. So the surgeon is going to come in once you're asleep enough. He's going to perform the procedure, and then you're actually going to go to recovery and you'll wake up. So anesthesia will kind of turn off those medications. And then we, once again, your safety is our priority, and we watch you very closely until you're awake enough that you can go back to the post-op area. So once you meet these certain criteria that we have in the surgery department to let us know that you're awake enough, that you're stable to go home, we'll get your IV out and you'll be able to go home. Now remember, somebody's got to drive you. The other thing that's important is that you've had some medication, so you do not want to make any kind of big decisions. You don't want to operate any heavy equipment. Obviously, once again, no driving for the next 24 hours. That's really important. You'd be surprised how long some medications can last in your system. You may feel like you're fine, but it's really important that you don't do any big decisions or drive any heavy machinery for 24 hours. The other thing that's going to be important after this is remember that you have not had anything to eat or drink usually, at least, if not 2 days before, at least the night before. So it's going to be important to rehydrate, okay? Make sure that you're drinking lots of fluid. Any kind of fluid with electrolyte replacement is fine. A common complaint that we get is, stomach cramping and headache, and a lot of times this can just be related to being dehydrated. But it also can be related to the procedure as well, which we're going to talk about here in just a minute. So when do you need to call the doctor? You've had this colonoscopy, you've had this EGD, you're sitting at home, you're having symptoms, and you're not sure if they're normal or not. So once again, a mild headache or some cramping, mild cramping can be normal. It's something that you can be to be expected. If you can have a sore throat, sometimes if you've had this EGD. So things that you need to call the doctor immediately or go to the emergency department for are going to be things like a fever over 101 and chills. Okay, for a colonoscopy, if you start to have severe abdominal pain, severe swelling in your belly, don't sit around and worry about it. We want to know about it immediately. Call us or go to the emergency department if it's after hours or on the weekend. For EGD, if you start to have severe throat pain, if you have facial swelling, if you have some severe difficulty swallowing, these can all be signs that they could have maybe punctured your throat. So once again, we need to know about this immediately. If it's after hours or on the weekend, we need to see you in the emergency department. Excessive vomiting or coughing up blood. Now, sometimes after the procedure, because of medications, it's not uncommon to have vomiting. But if you have persistent vomiting that you can't control, or the coughing up blood or vomiting blood, then you need to call us immediately or go to the ER. Excessive rectal bleeding. Once again, some bleeding after colonoscopies can be normal, but if it's something, excessive and you don't sit around worrying about it, just give us a call. What we don't want you to do is sit around and worry about something, not knowing if it's normal or not. Like I said, please call the surgeon's office immediately if you get any of these symptoms. It's important to us that you feel like we are open and you can talk to us about stuff. We do not want you to sit at home worrying about any kind of side effects of the procedure. So we just want to say once again, thank you for choosing Rush Memorial Hospital. We'll be happy to answer any of your questions, talk to you more extensively about any of the information that we've given you today. We're just happy. We look forward to seeing you. We're happy that you chose us, and we're going to take excellent care of you.